Welcome back everyone. Now in this video we'll be discussing about the Wilson's disease. So what is Wilson's disease? This is an inherited disorder that causes too much copper to accumulate in the organs. So this particular disease has too much of copper. So we'll be discussing that what is the pathophysiology. So the pathophysiology of Wilson's disease is that there is a genetic defect which impairs the copper transport. So this impaired transport, this decreases the copper secretion into the bile, thus causing the copper overload and resultant accumulation in the liver, which begins at birth. So there is too much of copper in the body, and this goes into the brain, into the liver, and into the eyes. So one by one we'll be discussing the features. So if it goes into the brain, then this causes like flapping tremors. So here we can see the flapping tremors. This is best elicited by the extension of outstretched hands. So we can see that this tremor, the characteristics is like a wing beating tremor. So this flapping tremor is characteristic of the Wilson's disease, and this could be resting, intentional, and or postural tremors, often with a wing beating tremor. So suppose in your exams, if it is asked that wing beating tremor or asterexis, this is seen in which of the following? So the answer will be Wilson's disease. Okay, so remember the other features of Wilson's disease. These are the low ceruloplasmin, then cirrhosis is seen, corneal deposits, the KF rings, the Kayser-Fleischer rings. So I'll be discussing this in the next minute. Okay, and then we have the copper accumulation, carcinoma, hepatocellular carcinoma is seen, hemolytic anemia, then basal ganglia degeneration. These too much of copper gets accumulated and this causes degeneration. So Parkinsonian symptoms like asterexis, dementia. So all these things, all these different kinds of like tremors are seen here. So we'll be discussing about the next thing, and this will be about the KF rings, especially in the eyes. So this is very much important in usmles, in Neetpgs. They ask this question. These KF rings or the Kayser-Fleischer rings, these are common ophthalmologic findings in the Wilson's disease. So we can see on the screen this patient is having the KF rings here. Okay, so this is particularly seen in Wilson's disease. I'll show you the another picture of this KF rings. Now this is the other picture. Here we can see the KF rings. Okay, so this is typically seen in Wilson's disease. So remember that the other name of Wilson's disease is hepatolenticular degeneration. So I hope that this video was useful. This was about Wilson's disease, and thanks for watching guys.